Hi, my name is Dr. Azarani, and together with my husband, Dr. Iyari, who's a board certified geriatrician, we have a geriatric clinic in the Bay Area, California. Today, I want to talk about after COVID. So, this is a question that a lot of our patients ask. Does after COVID exist? Is it a real scientific term? And why am I suffering from all these side effects and malaise and fatigue and medical situation after I got COVID? So the short answer to that is yes, after COVID does exist. And a lot of people, unfortunately, around the world are suffering from it. What is lacking is the research and the understanding that what caused all these after COVID uh, situations that people are suffering from now. And they could vary from a lot of things. As I mentioned to you, some people come to our clinic and they're extremely tired. Their allergies have doubled and quadrupled and increased to a large extent. Some people had dormant medical situations such as heart issues, and all of a sudden it became fully blown and started affecting their health to a great extent. Some people started having autoimmune disease, which means that your immune system is attacking your body instead of dealing with viruses and bacteria and foreign objects that enter your body. Some other people have GI problems. Some people have rashes. So the manifestation differs in everybody, and some of these could be new or it could be dormant medical situations that they had many years ago that becomes exacerbated or exaggerated and severely affects their health currently. And so, what do you do in situations like that? So, the first thing is yes, COVID was a laboratory made virus, and it is a very strong virus. It is different from the common cold or the flu that we get. And in contrast to what a lot of people we've heard in the community who say it doesn't matter if you get COVID, the more you get it, the stronger your immune system becomes. It is not a virus that you want to get often or be affected by it because it's a very strong virus and it can have very strong effect on your health, on your body, on your immune system. And therefore, the best situation is to try to avoid it. And you can wear masks, and you can get vaccinated and all that things that we have heard through the past few years in order to avoid COVID. The unfortunate situation here is that the COVID virus mutates very fast, even quicker than the flu, which might change once a year or maybe twice a year. But the flu keeps changing from one country to the other. And for example, the vaccines that are being made for these different mutants, by the time they come to the laboratory, they are not effective anymore because the virus has mutated. And so, even though you get it, you might get COVID. So, it is a very complex situation. And if you are prone to diseases such as autoimmune disease, it might make everything worse for you. So, what is there to be done? So, the first thing is yes, it is true. There is such a thing as after COVID and the negative effects it has on your body. So, you're not imagining it. The second thing is that the research is in early stages. And even though a lot of laboratories around the world are trying to find out what is this virus long-term effect in your body, the research has not advanced yet to that point. It will in a few years, but not at this point. And the third thing is that the physicians who are just learning about that don't have a lot of help or medications or medical procedures that can provide to you to take care of your after COVID malaise. Now, there are situations where you can get help. The best thing is to talk either to your primary care, your internist, or your board certified geriatrician and ask them to refer you to centers that are doing research on after COVID and also are providing help. And most of these facilities are in teaching hospitals. So hospitals where they have a medical school, they have students, fellows, residents, and they do continuous research. So even if you go to your medical doctor and they don't believe in after COVID or they don't know where to send you, try to self-refer yourself to these big hospital institutions affiliated with universities and try to get the help you need. Some patients have, for example, been put on immune suppressants, and that has helped them. And some of the other people, the doctors are trying to deal with the specific organs in their body that has been affected the most and treated individually. In any case, in the next few years, there's going to be more help, and you will be able to go to a doctor and easily seek help for after COVID. For the time being, the most important thing is try to avoid it and not get sick in the first place. If you do get sick, that you take care of yourself, you see a doctor, you rest, you not spread it to other individuals, especially those who are vulnerable in the community. And if, God forbids, you come up with the after COVID circumstances or situations, immediately seek medical help and try to go to these centers where research is going on about after COVID and try to seek help. Thank you for watching this video. I'll see you next.